Okay. All right. So thought we would chat just a little bit about, the impact and implications of a parent living with serious mental health condition. We'll highlight psychosis since that's the area within which I work, but really we can think about it a bit more globally. So talking about some challenges in parenting due to symptoms of serious mental illness, the potential impact that serious mental illness could have on parenting style and parenting abilities, as well as on the children, and then identifying clinical implications. So, what we could be doing or what we could be considering as the providers. So when we're working with individuals, it truly is, and you've probably heard me say this before, but it is a direct disservice to that individual to not really have an understanding of who is in their family system, how is it functioning, what does it look like, and revisiting this and chatting about this whenever possible and to whatever extent they're willing to go. Um, you know, as a dog mom myself, I know that parenthood can be really overwhelming. I can't imagine having real human babies and children. And so, parenthood can be overwhelming for all of us, for everyone. But with individuals with a serious mental health condition, they might need some extra supports and kind of unique supports to reach their full parenting potential. And I think that that's really key, is helping them to reach that full potential of their abilities. I think about this similar to how you would think about employment support for somebody to help reach their full vocational potential, same kind of thing. So, taking an opportunity to discuss their satisfaction with parenting, with their relationships with their children, as part of whatever treatment you're providing, can be a really useful exercise. So just so we can kind of see the magnitude or the scope of those who might be impacted, 38 to 44% of people with schizophrenia or schizophrenia spectrum disorders have children. More women have children. More women with schizophrenia have children than men with schizophrenia, and more women with SMI have children at the same or higher rate than women that do not have a serious mental health condition. 17 to 25% of kids worldwide have at least one parent that's living with a mental health condition, and up to 55% of kids who have a parent with serious mental illness can go on to develop a mental health condition themselves. So this puts them at 2.5 times more risk because of both the genetic and contextual factors. So effective parenting, when we think about it, really involves being able to provide structure, be adept at information sharing, information gathering, communication skills, being able to strategize, and providing sort of that feedback loop with your children and within the family system. Thinking that parents, it's really helpful when a parent is goal-oriented, strategic, structured, all of those kinds of things that we know can be impaired or impacted with a serious mental health condition, especially something like schizophrenia or psychosis. And parenting really does require considering and meeting the physical needs, the emotional needs, the developmental, psychological needs of another human. And we know that when somebody is living with psychosis, that they may have difficulties in these areas. It may be difficult for them to understand another person's feelings, another person's mental states, what another person's intentions are. So those are some of the things that might be impaired. And psychosis specifically may cause disturbances in how somebody thinks or behaves, which can make it really hard to navigate an already difficult role of being a parent. So when we're looking more specifically at psychosis and its impact on parenting, it is a risk factor to a child's well-being. And so I think it's really important to be having these conversations so that we understand that our work with an individual patient or client not only impacts them, but you really have the ability to make positive impacts on their child or on the system if you're working with the child. So, all domains of parenting are potentially impacted when somebody is living with psychosis. Parent may experience with serious mental health conditions and with psychosis, depression, fatigue, difficulty focusing, trouble with routines, unpredictable absences if they're, hospitalized, And they might have difficulty with feeling like they're able to protect their child, or that they're able to have a true reciprocal relationship with that child. And so, these are all things that when you think about it, how can fatigue impact parenting? We all get tired. As a parent, if you have this fatigue, what about if you're taking medication to stabilize serious mental health symptoms like psychosis, and that medication causes severe fatigue? How does this impact the relationship with your children? And so making sure we're talking about things like this. Um, Mental illness more generally can impact your capacity to parent because you might not have the a concentration or the energy to really play or to have successful communication and interactions. Your parenting style might be impacted. So some parents are far more permissive if they're living with a mental health condition, because they feel like they can't implement that structure, those boundaries, those rules, or they become overly restrictive. Oftentimes this is because, they may have experiences or fears, based on their symptoms, for example, of paranoia. And in order to protect their child, they become very, very rigid, very restrictive in order to ensure that their child is safe, but it's from a belief system that isn't reality based. And so there's a consequence for children for that. And sometimes parent-child relationships, when there's a serious mental health condition involved, sometimes they become non-hierarchical. So, the child really helps to provide caregiving either to the parent, to other children in the home. And so, the dynamic shifts and roles change within that family system. Quality of parent-child relationships and their interactions can also be impacted. I don't think we're surprised by that. Like I was saying, protecting their child from their internal threats and they're externalizing those. And this can feel really unpredictable or confusing or scary or restrictive to a child. And also it can limit them with their developmentally normative exploration, going out and playing with others, spending the night at a friend's, best friend's home, being able to go out to go to school, whatever it might be, it can really limit, and in turn, impact their developmental stages or their work through their developmental stages. Parents may also have limited empathy at times, or ability to engage emotionally with their children. And obviously, we've all heard the term from way back then when of the schizophrenic mother or the refrigerator mother. The schizophrenic mother, you didn't know who you were coming home to. I love you, get away from me, come closer. Or the refrigerator mom, she just wasn't warm enough, and that's what caused psychosis. That's not so long ago in our history. And although we've dispelled those myths, it still is important to understand that the power and the importance of empathy and emotional engagement between parents and children. There are also obviously practical implications for parenting if somebody has a serious mental health condition. If they are hospitalized, is there a plan in place? They may not be emotionally or physically available at that time. They may have difficulty sticking to their own routines, and so helping children follow routines might be very, very difficult in the home. Children are often more likely to become the parents' carers or helpers or caring for others in the family. And so, a child's individual and interpersonal functioning may be impacted. Layered on top of this is, those individuals who are living with a serious mental health condition are disproportionately impacted by things like poverty, low levels of social support, trauma, substance abuse, homelessness, the list goes on. And this is especially true for women. So they already have this layer of adversity. And then they have sort of a social adversity as well due to their psychosis. They might be unemployed. They might be financially strapped. Housing might be unstable. They may have fewer social connections to assist them in parenting because, you always hear it takes a village, and it does oftentimes. And so therefore impacts the children, and that makes the children more likely to be exposed or experience social adversity. If you think about it, if parents are struggling with maintaining employment, which is resulting in financial difficulties, which means they can't buy the latest and greatest new tennis shoes, and the child gets teased at school. Every kid experiences teasing, but these children are more likely to experience those aspects of social adversity. And so there are all of these layers kind of rolled up into this ball of yarn. Children are at risk for developing, these issues socially. If a parent has an odd belief system, for example, or engages in odd behaviors due to their symptoms, this can lead to a child, their behavioral expressions with their peers. This can lead to sort of odd behaviors with their peers and their, in turn teasing or difficult in social or peer contexts. They might have cognitive, emotional, or behavioral difficulties. And they may end up with mental health problems as a child or as an adult. But that being said, I think, there are two important buts in this scenario. We have the opportunity to provide the support and intervention for these parents living with a serious mental health condition. And it really parenting can have a positive impact on these individuals. From the parents' stance, it gives them a sense of pride, a sense of purpose, a sense of meaning with their children. And it also can be a motivator to maintain their own well-being, to follow the treatment plan, to follow up with appointments, just for the benefit and the well-being of their child. It gives them that motivation that they may need. For moms specifically, you'll see improved self-esteem. They may stop substance use. They have a greater ability to handle their own mental health symptoms or psychiatric concerns when, they know that they have the responsibility to care for this other human. And for kids, they really develop resilience when they are surrounded by a good support system. So they have that social network around them. They're more independent oftentimes. They have this sort of sense of selflessness about them. They are typically more connected to a social support system than children that may not have a parent with a serious mental health condition. And they do have this great ability to kind of look at a situation and find the positive in it. And that, translates or generalizes to other areas in their lives. So protective factors, I think, are important to chat about as providers because these can sometimes supersede the risk of developing mental health difficulties. So some protective factors that can help children to build resilience are social support. And I started that because that's everywhere. That seems to be, one really, really important area to target. Providing age-appropriate, developmentally appropriate information about what's happening with their parent and the mental illness and the difficulties that come along with that. Protective factors like, healthy family functioning, feeling connected with the parent, having healthy coping skills, and also having a warm parent that's able to accept the child and, provide routines and monitoring. The more protective factors that the child has, their mental health, the potential for good mental health increases. So these protective factors become really important in these cases. So what can we do as all different types of providers? I think the first step is really thinking about who we work with that have children living with them. It can have enormous emotional importance, and it can be an extremely important aspect of an individual's life, of an individual's plans, their goals, their identity, how they see themselves. And so we really want to explore this with our patients. Parents with serious mental health conditions, they desire this acknowledgement or discussion from providers about this role that they find so important, and also their concerns that they may have. They're hoping that we're asking them these questions and providing support, information. Many of these needs related to parenting are unmet in adult psychiatric services, and that's pretty consistent in the literature. But many parents may be hesitant to seek out psychiatric care or guidance or just having discussions with us about their children because they fear negative consequences. Either in the past, they may have been separated or lost custody for a period of time. There are a lot of fears of negative consequences that can impact how these discussions are going to go, and so providing them with a safe space. If the individual is feeling inadequate as a parent or struggling with their parent-child relationship, self-worth, self-esteem, their quality of life, how stressed out they are. All of these things are really impacted. And so, we need to be, talking about this often, and revisiting this area often with our patients. And with the goal of aiming our interventions at, the parent, if you're working with them, or the child, but also the system. And so it's sort of like that three-tiered approach. So some things, that you can think about, addressing with a parent who has psychosis, some information that they could really benefit from. Discussions about how to improve their interactions with their child. Um, Talking about the family dynamic, the roles, everybody's level of satisfaction within that family system, how they view their mental health condition as impacting their relationships, impacting the child, impacting the system. It's very important for parents to understand a child's emotional needs based on their developmental stage, and also the potential consequences if these needs go unmet. And also, a focus on parents' coping skills. We see how important healthy adaptive coping is for children. Where do they learn that? Most often modeling from the parents. So the more that we can build up those parents' resources and the coping skills, the better off the whole family will be. Talking about the mental health diagnosis in a developmentally appropriate way. So the children really need information about what's happening with mom or with dad or with their parent. Parents really are typically unsure about how to discuss this, what to say, how much to say. Sometimes this can lead to oversharing or age-inappropriate sharing, or not sharing at all, not providing enough information, or just avoiding the topic altogether. It becomes sort of the unspoken thing in the house. So one resource that I really love is out of Australia, and that's Children of Parents with a Mental Illness, and they have wonderful resources that target different ages, some specific conditions, handouts that you can share, talking points. So it's a wonderful resource to explore and click around in. That you can share with parents, and then offer them guidance on how to have these discussions with their children if you're not going to see the children as well. Child's behavior management strategies are really helpful for these parents, and something that they're really interested in learning more about. Talking about appropriate discipline and boundaries, how to create and maintain routines for themselves and for the family system, planning in advance, all of these things that we sort of talk about with an individual client who happens to be a parent, and then extending that, taking it one step further to really have a focus on the children. Connecting them with resources, helping to strengthen and build their social network, discussing negative and depressive symptoms with the parent. Are they experiencing these feelings of inadequacy or guilt or shame or fear or grief? And, opening up the floor to those discussions. And talking about their perspective of, if they, for example, are experiencing the symptom of fatigue, is this due to illness? Is this a side effect of medication? This might be a reason, if they're a parent, that they stop taking medication, aren't happy about the medication because they feel like they can't be working at their best as a parent. And it may be medication side effects that need to be discussed. These parents, with a serious mental health condition, they really do have a desire for additional support in this parenting role, and that can look like education, skills, resources, a safe place to have these discussions. Family peers, which are now, family peer support specialists, which are now available in Ohio, can be a really useful tool. Groups where they have, shared family experience or shared parenting experience, living with a mental health condition and having children, can also be a really normalizing and healthy experience for many parents, and can give them some guidance and make them feel supported. So, overall, I think this is a really nice opportunity for us as providers to provide these parents with assistance so they can really reach their fullest parenting potential. And whenever possible, trying to pull in other family members or support people to help build that support network around them, especially if they're involved with, childcare or child rearing, because not only can they offer support to that parents, but it also helps to relieve some of the burden of a child who's been placed in a caregiving role. So I added a couple resources. Obviously, the Cope Me is my favorite, but there are a couple other resources here, and the references. So happy to answer any questions or if anybody has something they want to discuss. But thank you.